Ahead of the rollout of coronavirus vaccine on the 16th of January, Prime Minister Narendra Modi interacted with chief ministers of all states to discuss the COVID-19 situation and, of course, the vaccination rollout in the country. It was the first meeting between the Prime Minister and the chief ministers after the Drug Controller General of India gave restricted emergency use approval to two vaccines, Oxford AstraZeneca's vaccine, which is called Covishield in India, being manufactured by the Serum Institute, and Bharat Biotech's Covaxin. Prime Minister Modi said India is entering a decisive phase of vaccination in the fight against COVID-19, asserting that the two approved made in India COVID-19 vaccines are more cost-effective than any other in the world and have been developed as per the country's needs. In fact, he also announced that in the first phase, the cost of vaccination for the 3 crore healthcare workers and frontline workers would be borne by the central government. On this edition of the Big Picture, we will analyze the significant points made by the Prime Minister as we get ready for the world's largest inoculation drive and the vaccine preparedness across the country. Joining me on the program are Dr. Raman R. Gangakhedkar, Dr. C.G. Pandit, National Chair, ICMR, Urvashi Prasad, Public Policy Specialist, Niti Aayog, and Dr. Puneet Mishra, Co-Investigator, Covaxin, at the All India Institute of Medical Sciences, New Delhi. Thank you to all my guests for joining me on the Big Picture today. Urvashi Prasad, let me begin the program with you. Your response to the significant points made by the Prime Minister in this crucial meet with the Chief Ministers ahead of the vaccine rollout.
So I think the Prime Minister has, he sort of emphasized and went over some of the key preparatory aspects that have been undertaken. Of course, the government has spent a lot of time in preparing for this vaccine rollout prior to the approval that we got, both in terms of the physical infrastructure, the cold chain, as well as the human resource. So training of trainers has been carried out, and the digital aspect, which is something the Prime Minister did emphasize, the COVID application and the ability to register yourself there, to generate digital certificates, etc. Technology, as we know, has played a big role throughout this pandemic management in India, and is expected to do so even during this vaccination drive. And I think one of the other important aspects of what he's emphasized, apart from, of course, the various preparatory aspects, is also the community participation, the Jan Bhagidari that he's spoken about, because any effort like this cannot be carried out by the health system alone. There are going to be a number of stakeholders who will be involved within the health system, of course, but also outside. And people themselves, communities themselves will have a very big role to play, especially in, when we have situations where there can be some vaccine hesitancy or there can be some myths or misconceptions. So the communities themselves will also have, people themselves will also have a very important role to play. And I think this is something that he's also been emphasizing from the outset.
Yes, of course. Vaccine hesitancy is something that could be one of the potential challenges going forward. But we'll talk about that later on in the program as well. First, looking at the positive aspects of the vaccine rollout that we are set to launch this week. Dr. Gangakhedkar, let me come to you. So as we get ready for the vaccine rollout, the Prime Minister himself has sought to quell all the apprehensions regarding the two vaccines that have been approved in the country in terms of both efficacy and also affordability. So can we now begin to be hopeful that the pandemic is under control, will now be under control?
Prime Minister has given what he feels as one of the advice to people.
Yes.
But one of the things which is essential, if we want to overcome this outbreak, we have to ensure that we will continue to follow COVID appropriate behavior, and we would also add one more weapon in our armamentarium of taking vaccine in a sequence. No, even if it is a prioritized population, perhaps it's also going to be rolled out subsequently to other populations. But the issue is people have to take the vaccine. People have to spread the word as to how this vaccine could be effective, how there are no side effects that are associated with it. And only then, if they bring more and more people to take the vaccine, only then perhaps we will be able to have a high level of protection that would be generated through these vaccines and the protective COVID appropriate behavior that we would follow. And only then, perhaps over a period of time, that we would be able to see that the disease is eliminated.
Okay. Dr. Puneet Mishra, so we've been undergoing massive preparations for the rollout. There have been 3 rounds of dry run as well. The states have been making different sorts of arrangements in their respective areas as well in order to conduct a smooth and effective drive. What are the weak areas that have been identified during these mock drills, and what is being done to actually ensure that they don't hamper the rollout going forward?
Yeah, since it is going to be one of the biggest vaccine drives in the country, and so dry run was necessary to find out our preparations. And during this phase, as you know, that everything from logistics to calling patients and giving them vaccine and then keeping them for under observation for 30 minutes. So everything was tested at certain places where there were certain lacunae, like at few places there was some problem with the electricity, or there is some problem how to use a COVID platform or how to keep the patients or these participants for 30 minutes. There were some minor issues at some places, and those has been resolved. In certain places it could be started little late. People even after SMS they reach late. So all those things they have been taken care of, and I think now we are fully prepared for the vaccination drive from 16th. And that's why our Honorable Prime Minister, he has come today. He has interacted with the chief ministers because, in any case, health is a subject matter of state. So it is always important that keep a dialogue with the chief ministers. And that's what our Prime Minister has done today. And he has briefed everyone about, about the priority group and how the vaccine would be given. He has also pointed out about the COVID appropriate behavior and then about the rumors, because there are a lot of rumors going on. So he has discussed that point as well. And the most important thing which I feel the Prime Minister has communicated to the, our citizens, that though we are going to have this program on the vaccine, COVID vaccine, some people, they have apprehensions because of this program, we might lose on the routine immunization program. So he has assured that routine immunization program would not be hampered, that will go on, because that is program very important for our children. So I think he has taken, overall the picture in mind, along with the COVID, the other activities which are routine activities, they should not get disturbed, all the important activity, and they should go on. So I think in that way, it was quite his introduction today was quite good, and all the lessons which we have learned from dry run and then guidance from health authorities, we would be able to run a successful program from 15th onwards.
So we are confident going forward that we'll carry out and conduct an effective and smooth vaccination rollout. Mr. Mishra, one more question before I go ahead on the potential challenges that we could face. That vaccinators have been trained effectively to carry out the inoculation program. But considering that of the 2 vaccines, one of them is a live vaccine and the other is an inactivated vaccine, what are the kind of guidelines that need to be followed by the vaccinators?
See, the most important thing for the vaccine is that you maintain all the SOPs, and those include keeping the vaccine at the right temperature. So all the precautions for keeping them at the right temperature has been taken care of. Then all the vaccinators, they should know how to inject the vaccine, and it is given through intramuscular route. So all of them, they are well trained, and they know what are the side effects for which they have to keep a watch when a person is there for 30 minutes. So all the trainings has been given in phase 1 and phase 2 trial. These 2 vaccines, they have been found quite safe. So we don't expect any major side effect, but however, some people might experience, little pain or redness. And in case if there's any severe side effects, so all the safety instruments and important drugs which are used in emergency, they will be kept at these centers so that any eventuality, if it is there, can be treated on the site. That is a rare occurrence, and in case if required, these cases can be sent to the hospital.
So we are prepared to deal with any kind of emergency as well. Coming back to you, Urvashi Prasad, to understand more about the COVID application, which in fact is being touted as the most important pillar going ahead in the inoculation drive. Tell us more about how this system will work, and does it ensure an end-to-end solution covering all layers of the health delivery system, which goes up to the vaccinator level as well?
Yes, so the system has different aspects to it. I mentioned the beneficiary interface and registration, and then eventually being able to track the number of doses people have got, and also generating and storing their digital vaccination certificates. So that is very much on the beneficiary side. But on the logistical side, it can also provide real-time tracking and status of the cold chain. If there are any issues, then the system can alert so that timely corrective action can be taken. So it does have that capacity also built in to provide that kind of real-time tracking on the logistical side as well. Now, of course, the dry runs did throw up certain challenges. Sometimes there are internet-related issues or other such issues which can affect how effectively this application functions. But hopefully, now that they have been identified, they can also be corrected and appropriate steps can be taken so that once the actual rollout begins, we don't face too many of these issues. But technology, it's obviously not a solution in itself. It's going to be a very important aid to the whole process. It's going to support the whole process. Of course, it cannot take away from the actual work that everybody involved, the human resources, people involved will need to do. But it can certainly be a very important aid to them, and it can certainly provide them with the relevant updates, the real-time updates, and as well as, of course, at the beneficiary end, it can streamline the process a lot, because we will have eventually large numbers of people who will be registering for this, who will need to be tracked in terms of how many doses they've had, and so on and so forth. So definitely a digital system, a technology-enabled system can make all of that much simpler.
And what kind of caution that needs to be exercised to ensure that there is no proxy? How will the beneficiaries be identified uniquely?
Yeah, so I think, and this is something the government has also mentioned in terms of the linkages with Aadhaar, and all of that is also being worked out at this point in time. Of course, for beneficiary identification, at the identification stage itself, a lot of care is being taken. Separate templates have been developed for the healthcare workers, the frontline workers, and then eventually when the vaccine actually rolls out to people above 50 years of age and below 50 years of age who have severe comorbidities, the electoral rolls, etc., how they would be used to develop these lists. So, of course, generating these lists and generating the beneficiaries who will be vaccinated, that process itself is being planned very meticulously, and that is in fact part of the whole process.